Hello, dear learners and dear students. Welcome to my channel, Microbiology Tutorials. Today, I am going to discuss about one of the most important topic, that is immune hemolytic anemias, classification, pathogenesis, clinical symptoms, and diagnosis. Most of you would have been aware that anemia is caused by a loss of red blood cells. Red blood cells are one of the most important blood cells in our body, whose main important function is to transport oxygen from lungs to the different tissues for their respiratory processes and synthesis of ATP. And if the red blood cells count uh, goes lower level from the normal, they are unable to transport oxygen to different body parts, including organs, cells, and tissues. And the vital functions of these body parts are not properly performed, or these body parts are not able to perform their functions. And as such, hypoxic conditions or anoxia conditions starts there, and slowly the organ starts dysfunctioning, which may be related, which may cause some of the other important disorders. So the count of blood cells in the body is very important, and if there is a drop in their count, it causes anemia. Anemia is caused by different types. It may be due to iron deficiency, which is important for hemoglobin formation in the blood, or it may be due to vitamin B12 or folic acid deficiency, as well as it may be due to certain genetic disorders, which causes red cell membrane defects, enzyme deficiency, and not the main normal hemoglobin are not synthesized. So either either it may be acquired or genetic. Now here, those are some of the important. In addition to that, there are certain conditions where the immune system may cause our body's immune system also, if their functions are dysregulated, then they may also cause anemia. And two important types are there, where immune system starts destroying its own red blood cells. As the name itself suggests, immune cells here means the antibodies. Hemolytic means lysis of red blood cells. And as the lysis of red blood cells takes place, obviously anemic conditions are caused. Now here we will see the important mechanism of immune hemolytic anemias, their etiology or causative agents, what are the important clinical symptoms, and diagnosis. So first of all, if if you see this diagram, you can easily visualize that here one is the autoantibody production against the red blood cells. Means that the autoantibody means antibodies which are produced against its own host cells. Means that instead of damaging foreign cells, they start damaging their own cells. And here, when these autoantibodies are produced against the red blood cells, they causes lysis of red blood cells, and as the lysis takes place, it will lead to reduction in the red blood cells count, and finally it causes anemia. Here you can see the mechanism of RBC destruction. So here there are two types of autoantibodies which are produced here. One is the warm autoantibody, that is warm AIHA, which is IgG mediated, and it causes extravascular hemolysis. And we will see what is warm autoantibody and cold antibody in preceding slides. So next is the cold autoantibody, which is IgM mediated, which causes both intravascular and extravascular hemolysis. Intravascular is within the blood vessels, and extravascular outside the blood vessels. So here you can see complement in addition to IgM. There are two important complements, that is the C3b and C4b activation also takes place, which binds to the red blood cell surface. And finally, here IgM antibody binds strongly, as such complement activation takes place. And due to complement activation, there is a membrane attack complex is formed, and which finally leads to the lysis of the red blood cells. Now, we already know that when increased lysis of red blood cells takes place, then there is a they break down into different components, and one of the important component is the bilirubin, which is usually stored by the liver cells. Now here, when as the more in destruction of red blood cells take place, so more bilirubin is formed, and excess bilirubin formation causes the condition called as the jaundice, and it may lead to the damage to the liver cells also. So one of the important conditions, which is the complicated consequences of this type of anemia, is the elevated bilirubin. It is also in other cases also we see that when excess amount of red blood cells is seen, then jaundice is one of the predominant conditions existing in such cases. And finally, we know that as more and more red blood cells are destroyed, so more activation of spleen cells also takes place, because it is the graveyard of RBC, where RBCs are destroyed, and as such there is an enlargement of hemoglobin. Moreover, you can see second one here, which is in the case of warm AIHA, that is IgG antibody. Here, phagocytosis of this antibody attached RBCs takes place in the spleen and liver, which is the incomplete phagocytosis. And finally, it also causes the condition of anemic conditions. Again, second antibody, here we already have seen that about warm AIHA and the cold AIHA. That is next important is the also, in addition to autoantibodies, other antibody is the alloantibodies, which also causes hemolytic anemia. So here what happens, what is now here alloantibodies? So alloantibodies are those antibodies which are usually formed when there is a transfusion of blood transfusion reaction takes place, or when the Rh negative mothers have Rh positive babies in their during their pregnancies. So in these two conditions, the allo antibodies are formed and they causes feto-maternal hemorrhage. So here, what is the feto-maternal hemorrhage? So it is two type of conditions we will see in detail. So here you can see here allo antibodies, that is the transfusion induced B cells or pregnancy induced B cells in which allo antibodies is formed, and here then immunization event takes place, that is the transfusion or pregnancy or allo antibody production. Now here the immunization, which is also called as the allo immunization, is not the condition of any immunity. Basically, what happens that when the antibodies, the blood cells which are Rh positive, when they pass from the fetus to mother through placenta, suddenly the immune system of the mother gets sensitized because the Rh factor, which is a protein present on the blood cells of the fetus, they and the mother do not have that Rh factor, so it is recognized as foreign, and the body of the immune system of the mother gets sensitized. In that case, means that they give information to immune system, or they trigger the immune system to develop antibodies against such and such red blood cells, or we can say Rh factor. Now here, one important thing to note, that the first baby which is born is normal, because only in that case only sensitization takes place, and they are not acting against. Next important thing is that IgM antibodies are the first antibodies which are produced there, and as such IgM antibodies which are produced, they cannot cross the placenta to the fetus. So here, usually the first baby which is born remains normal, but conditions becomes complicated during the second pregnancy, when the immune system has already stored a memory against the Rh positive blood cells. Now here what happens, that as soon as the Rh positive blood passes through the placenta to the mother blood stream, so antibodies starts start destroying those blood cells. And even since IgG antibodies are also synthesized in that cases, they cross the placental barrier and enters into the through placenta to the fetus, and also causes destruction of the red blood cells of the fetus. Now here, usually what happens that in the alloimmunization, it is in the context of Rh incompatibility is primarily prevented. How it can be prevented? So it is prevented through Rh Ig immunoglobulin, which mimics the body's innate immunity antibodies. If the pregnant client is exposed to the positive fetal blood, then body does not react, as it perceives that the needed antibodies are already present there. So they mimic it, and the basically the triggering of the immune system does not take place. So usually, so this is also called as the name by the ROGAM, RHOGAM, and RHIG immunoglobulin is routinely administered via intramuscular injection. at 28 weeks of pregnancy, then within 72 hours of birth, and as needed, that is 28 weeks if concerned for feto-maternal hemorrhage. Now, the intervention significantly reduces the risk of allogenization in future pregnancy. So, RHIG is one of the most important preventive measures, or we can say the administration, which prevents the such type of feto-maternal hemorrhage. Now here, one of the most important type is that how we will classify the immune hemolytic anemia. Now here, one important that it may be the alloimmune and hemolytic anemia. It is two type, that is the hemolytic transfusion reactions. It is in the ABO mismatch. Now here, what I have discussed is about the RH incompatibility. Another type of alloantibody or immune hemolytic anemia can take place through ABO incompatibility. Now here ABO incompatibility, what happens here? So in ABO mismatch, naturally occurring IgM type antibodies active at 37 degrees centigrade are present in the recipient's serum. These antibodies coat the donor red cells with complement, and its activation to C9 results in intravascular hemolysis. So here, basically what happens that in case of ABO incompatibility, and one is the RH incompatibility. So RH incompatibility, when I already said that when RH negative mother conceives a baby or a child with the RH positive blood group, and in the ABO incompatibility, what happens that there is a mismatch ABO blood type. That is, for example, is the birth mother with type O body baby with A or B. So here it is not the relation of positivity. Usually, if we cite an example, suppose a mother which is with having a type O blood group is conceiving or giving birth to a baby which have a type A or type B blood group. So here there are chances that mother may produce antibodies against the type A or type B blood group fetus. Okay, so here we can say that two types of important here is one is the transfusion reaction, hemolytic transfusion reactions. In hemolytic transfusion reactions is usually that when mismatch blood group transfusion takes place, or when the body is not accepting the donor's blood. Next is the hemolytic disease of the newborn, which we have already discussed. Now, next is the important thing, that is the autoimmune hemolytic reaction. So, what is the autoimmune hemolytic anemia? So, here you can see here, which we already have discussed about this. Now, coming to the autoimmune hemolytic anemias, if you classify it, so I have already said that it is basically caused by two antibodies. One is the warm antibodies and one is the cold antibodies. Means that it is dependent on temperature. So what is the warm antibodies? Warm antibodies are those antibodies which react with red cell antigens at 37 degrees centigrade. Cold antibodies are those antibodies which react with red cell antigens at 32 degrees centigrade. Now here, one important thing, that warm antibodies are these antibodies readily combined with red cell antigens is dependent on the temperature, and accordingly AHS has been classified into two types, that is the warm antibodies and cold antibodies. Warm antibodies are which react with already said 37 degrees centigrade, and they are mainly of IgG type and do not fix complements. You have seen in the diagrammatic representation also. If I show you again, just 1 minute. So here you can see here this warm AIHA is IgG dependent, and here no complement activation takes place. Whereas in the cold AIHA, which is of IgM type, and here the complement activation will take place, and they react at 32 degrees centigrade. Now here again, so these antibodies are preponderantly of IgM type, fixed complement, and results in intravascular hemolysis or say sensitized RBCs, and are lysed by reticuloendothelial cells of liver and spleen. There is hemoglobinemia and hemoglobinuria when the red cells with attached antibodies reach in warmer parts of the body. The bound antibodies gets detached. Now, usually we see that in the cold AIHA, what happens that if it goes at the higher temperature body parts, so these antibodies or and the complement which are attached to the RBCs get detached itself. Now, next is the warm autoimmune hemolytic anemia. The autoimmune hemolytic anemia is due to the presence of IgG antibodies which react with red cells at body temperature of 37 degrees centigrade. This is the most common autoimmune hemolytic anemia, comprising of 70 to 75% of adult cases. Now, we know that the body temperature is 37 degrees centigrade, and most of the autoimmune hemolytic anemia, because the overall body temperature is 37, so 70 to 75% cases of autoimmune hemolytic anemia are of the warm autoantibody cases. Now here what happens, that there are two mechanisms of hemolysis here. What are the two important mechanisms? That phagocytosis of antibody coated red cells by spleen through Fc portion of antibody RBC complex. So already if you have knowing the antibody, so you would be knowing that there are two regions, that is the Fab region of in the antibody and antigen binding portion, and one is the Fc portion, the Y portion. In the tail, the down part is the Fc portion, the upper part is the Fab portions. Now what happens that the antibody, all warm IgG antibodies of WA warm and autoantibody mediate hemolysis via these mechanism. That is the phagocytosis of antibody coated red cells by spleen through Fc portion of antibody RBC complex. If you see here, if I show you, you can easily see that here the phagocytosis takes place and they binds in the spleen part to the Fc portion. Here you see here the Fc portions of the antibodies are attached to the phagocytic cells. Next, mechanism is that sometimes a part of red cell is taken up by the macrophages of spleen, and that part of red cells is lost, and the remaining RBC assumes spheroidal shapes, and the spherocytes are formed, which are sequestered in spleen. Second is they lose their biconcave shape. The RBCs of biconcave shape, and they become spheroidal shapes, and spherocytes are then destroyed by the or sequestered in the spleen. Third, antibody dependent cell mediated cytotoxicity of red cells is carried out by CD8 plus T cells and natural killer cells in spleen, resulting in hemolysis. Now, some of the important clinical features of warm AIHA is age, that it occurs at all ages. Majority of the cases are in childhood, in third decade, and in the fifth decade. There is Female preponderance with a F ratio, M ratio of 2:1 means that if two females are affected, one male is affected. So in females, there are more chances, and it is common in all age groups and especially in children. Second is drug intake. History of drug intake, especially of M-DOPA, must be excluded here. Then onset is usually insidious. Sometimes onset is acute and rapidly developing pallor. However, the attack is short-lived. Pallor, progressively increasing pallor is the presenting complaint in the case of warm AIHA. Then jaundice, the patients also manifest icterus. Then splenomegaly is mild with the spleen 1 to 4 centimeter below posterior margin. And secondary AIHA systemic examination is essential to rule out secondary hemolytic anemia. Now, what are some of the important hematological findings which we see here? So hemoglobin and packed cell volume fall in the range of 5 to 9 gram percent and 14 to 28% respectively. So there is a drop in the level of hemoglobin as well as the packed cell volume. Next is the reticulocyte count. Reticulocytosis is moderate, 5 to 20%. Usually, they should not exist more than 2%. And reticulocytes, if you say they are immature RBCs. Immature RBCs means when the bone marrow are forming the red blood cells, they go through the red blood cells or other white blood cells or platelets, especially red blood cells and white blood cells. They go through series of transformations in bone marrow, and finally the mature RBCs or WBCs are released in the bloodstream. But as the red blood cell count or mature red blood cell count decreases, suddenly the immature red blood cells count increases in the bloodstream, and which indicates a type of anemic conditions. So here there is a moderate increase, means that there is an increase but not to an extreme level, and it is to 5 to 20%. Next, in peripheral smear, what it shows that it demonstrates polychromasia. If reticulocyte count is increases, polychromasia will be there, and spherocytosis with few nucleated RBCs. Nucleated RBC means that immature red blood cells are more in the peripheral smears. Monocytes may demonstrate erythrophagocytosis. Now, anti-globulin test, which is also called as the Coombs test. So, direct anti-globulin test, that is the DAT, is positive in 90 to 95% cases here, indicating the presence of IgG or C prime or IgG plus C prime on the red blood cell surface. A more sensitive micro Coombs test to detect low levels of antibodies is now available. In warm type antibody, it is the IgG which mediates hemolysis. Then serum bilirubin. Serum bilirubin, a mild to moderate increase in serum bilirubin, mainly of unconjugated type, is present. Urobilinogen, urine urobilinogen is increased. LDH is increased due to lysis of red cells. Then intravascular hemolysis, hemoglobinuria, and hemosideruria follow severe hemolysis and LE cell test. LE cell lupus test is there. If the LE cell test is positive in cases of SLE, systemic lupus erythematosus with secondary AIHA. Now, what is the principle of management? How we can manage it? So here, most of the AIHA cases are treated with corticosteroids, and here prednisolone is given in dosage of 1 to 2 mg per kg body weight per day. High doses of steroids continued for 2 weeks, and in case of responders, the dose is gradually reduced in the next 4 to 6 weeks. The second drug of choice is rituximab. Non-responders are treated with cytotoxic drugs like azathioprine, cyclophosphamide, and cyclosporine. Splenectomy is considered in cases where steroids are not of much help in limiting the hemolysis. Recently, rituximab, which targets immunoglobulin producing B cells have been found to be effective in steroid resistant cases. Next, drug-induced hemolytic anemia. Drugs-induced antibody production causes hemolysis by three mechanisms: heparin type, example is penicillin, and cephalosporins. Here, what happens that some drugs and their metabolites act as haptens, means that they are type of incomplete antigens and are adsorbed on the red cell membrane. IgG antibodies to the drug are formed combined with drug on red cell membrane. Such red cells are sequestered in spleen, resulting in extravascular hemolysis. Example is penicillin and cephalosporins. The latter one is the commonest drug resulting in hemolytic anemia. So that's why it is also said that the side effects are in some cases of drug administrations are very severe, or when the antibiotic or other drugs are administered, so it should be administered very carefully and not incessantly, means that it should not be there should be a monitoring when we are administering the drugs. Then innocent bystander type, that is the immune complex type. So drug forms a drug protein complex with a plasma protein. This stimulates antibody synthesis. Antibody combines with drug protein complex while it is still in plasma. The drug protein antibody complex binds with complement to red cells. That is the innocent, that is also called innocent bystander, resulting in intravascular hemolysis. That is example is quinidine and non-steroidal anti-inflammatory drugs. So one type of drug causes extravascular hemolysis, whereas the bystander type, or where there is a drug protein complex with the plasma protein, so this stimulate antibody synthesis and it causes intravascular hemolysis. Next important is the autoimmune or alpha and dopa type. What is this? There is a production of warm antibodies specific for RHS antigens or RBC surface on RBC surface by M-DOPA. These antibodies bind to red cell membrane, resulting in hemolysis. However, the drug does not bind to the red cell membrane. The example are alpha M-DOPA and fludarabine, which is used. The latter drug is used in chronic lymphoproliferative disorders. Immune hemolysis in drug-induced hemolytic anemia is usually mild to moderate. All suspicious drugs should be stopped immediately. Steroids may be considered in cases with chronic hemolysis. Now coming to the cold AIHA. So in cold AIHA, there are two types. In this type of AIHA, IgM autoantibodies or cold agglutinins bind to red cells at lower temperature of 0 to 4 degree centigrade. Here, cold agglutinin disease and paroxysmal cold hemoglobinuria are two types, and these constitute 20% of AIHA. This is because it occurs at lower temperature, and most of the body parts have higher temperature, 37 degrees. So it is in less clinical conditions of cold AIHA exists. Here, the antibody, as we all know, that is the IgM antibodies, which is involved. Moreover, there is also a complement activation forming a membrane attack complex, and C3b opsonized red blood cells are removed by RE cells, mainly by of liver and spleen. Now, here, what happens that acrocyanosis of hands, feet, nose, and ears is present. So basically, we can say that the peripheral part of the body, they get affected in the cold AIHA cases. That is the hands, feet, nose, and ears. Then digits becomes purple with numbness and is reversible upon warming them. So they become numbness is experienced, means that there is no sensation or feeling. Sensation is less there, but it recovers as there is a heating of that body part. And idiopathic CAD is observed in older patients greater than 60%, 60 years of age. There's a mild chronic hemolytic anemia with episodes of hemolysis in December, January in India. Mechanism of hemolysis is complement activations and C3b opsonized red blood cells. Next is the agglutination Coombs test is positive. Secondary cold antibody hemolysis may occur following development of IgM antibodies in infectious nucleosis and following mycoplasma pneumonia infections, Epstein-Barr virus infection, measles, mumps, rubella, varicella, HIV infection, hepatitis, and cytomegalovirus infections. Lymphoproliferative disorders like NHL and CL may be associated with cold agglutinin disease. And second is the paroxysmal cold hemoglobinuria. In this rare cold AIHA, there are stacks of intravascular hemolysis with hemoglobinuria on exposure to cold. Donath and Landsteiner describe such cases in congenital and tertiary syphilis. However, majority of cases seen nowadays are of acute viral infections. So viral infections play a significant role in cold hemolytic anemia. Clinical features: children and young adults are mainly affected. Clinical features of hemolysis usually follow upper respiratory tract viral infections. Patients present with sudden development of pallor and abdominal pain, headache, leg cramps, fever, chills, rigor, and vomiting following exposure to cold. So these are some of the important types of hemolytic anemia. To summarize, obviously there are two types. One is the autoantibody and other is the alloantibody. Alloantibody is transfusion reactions, or that is the hemolytic disease of the newborn. It may be ABO incompatibility or RH incompatibility test, whereas autoantibodies, there are two types. One is cold autoantibody and warm autoantibody. Cold antibody IgM type is involved and complement activation is also takes place. Whereas warm antibody, there is IgG antibody. Here extravascular hemolysis takes place. Whereas in cold antibody, there is intravascular hemolysis, and with that some other clinical conditions persist. And also we discussed here that which are some of the important drugs or some of the important conditions in which in case of cold weather conditions the cold AIHA conditions exist. So and some of the important viral infections in which such type of anemic conditions exist in the cells or in the host body. So with this, I conclude my today's lecture. I hope you have certainly gained some vital information regarding the hemolytic anemias. And please do like and subscribe my channel if you like my video, which always keeps me motivated to bring more new informative and knowledgeable videos for you. Thank you all.